Hi there. Thank you for joining us once again. I am Dr. Mahendra Carpen, and we continue the program, Your Doctor and COVID. I'm the head of medical services and cardiology at the Georgetown Public Hospital, and today we continue our conversations with Dr. Devendranan Sharma, a professor of behavioral science and an expert in the field of mental health. Welcome again, Dr. Sharma.
Thank you, Dr. Carpen.
So we'll just get right into our discussion. We continue our talks and our conversation around COVID-19 pandemic and the way it's been affecting the entire human body from head to toe. Mental health is an important aspect, an important facet to the human being. And so we wanted to make sure that our viewers and listeners continue to have an improving understanding of this very, very important aspect. So why is mental health in general important, and more so in the COVID-19 pandemic era?
It's important because it's one of the most significant functions of our bodies. The function is from our brain. So our mental health is coming from our brain. To be in good mental health means we're in good brain health. And mental health covers the areas of our thinking, our emotions, and our behaviors. Maybe we could add our personality itself is a facet of our brain function. How we are as people is because of how we're thinking, how we feel, how we act. So those are all facets of the brain. And you know, we all specialists in our own fields, and you Doc, will argue the heart is the most important, but I will argue the brain is the most important.
Yeah.
But it is significant, and it's really truly sad that many persons neglect their brain health because they feel shy to talk about their emotional feelings, and it's not their fault. It's the way society has looked at mental health. And as I said before, it's because probably your words themselves carry a poor message. To call somebody mental may carry a negative connotation, and people don't want to be associated with that kind of word. And many systems are now changing the word into behavioral and brain health. Brain and behavioral health is much more a sensible way of describing what we would call mental health issues.
Okay. So in this COVID pandemic, in this era that we live in now, are there any specific groups that are more at risk for the development of mental health or brain disorders?
True, and the groups are the extremes of life. They're always vulnerable. Our children and our elderly. The elderly tend to keep their feelings to themselves and suffer in silence. But they may be feeling the dangers of loss of people, the sadness of loss, the dangers of themselves dying. And so there's a lot of fear among this group. Among our children, there's a lot of fear that is reflected by the way they see the adults behaving, and because of the change of their lifestyle that they're accustomed to. Children are not persons or individuals who are accustomed to be locked away in their homes, so that's been a very tough experience for them. And we've seen some very sad, unfortunate cases of young people committing suicide, seemingly to be related to feelings of isolation and change that they didn't cope well with. So those are two particular vulnerable groups. Our women folks also are somewhat vulnerable because they're left to carry much of the teaching and the supervision of their children, and trying to balance home and trying to deal with the difficulties of managing life in these new times. Sometimes economics are very difficult for persons, the moms and caregivers. We have persons with health problems, as you know, who would be also considered vulnerable, and people with underlying mental health disorders or disabilities. Right. These are also vulnerable people.
Have you found in your own practice that your usual patients are somewhat a little bit more affected, need more help, more care during this COVID-19 pandemic? Has this pandemic unmasked or removed some protection that those persons would have had ordinarily?
Yes, I think it's kind of actually unmasked everybody's fear of dying and the fear of being infected and the fear of being quarantined. There's so many fears that have happened. We see people who feel that they're vulnerable. I've had young physicians even who have come to me worrying that they may get sick because of their patients. I've seen people who have developed COVID who have had very unusual reactions of extreme fear and panic, and so there are a lot of people who were experiencing the stress related to COVID, and there's also the side of it where some people are keeping their fears to themselves, and that's be bottled up and coming out in the form of depression, you know. So a lot of persons are suffering with depressions and not talking about it. But within my group of patients, I'm seeing a fair number of people directly suffering emotional problems, especially anxiety problems, sleep disorders, and panic attacks related to COVID.
Would your field cover things like domestic abuse and that kind of behavioral aberrations?
Oh, absolutely, because the thing about mental health issues, it's broad. It's linked to behavioral issues of domestic violence, anger, irritability, anger problems that people can't control and they express it by violence. People who are not able to cope with each other when they're now too often and too much time spent in the house situation, and then they may be using alcohol, but brings out again very negative behaviors. We're seeing problems in vehicular accidents related to drinking. It's been a problem in our society for a long time. Domestic violence, unfortunately, also related to secondary use of alcohol. So many behavioral problems. Criminal activities, unfortunately, also seeming to be a problem, a behavioral problem. You know, Doc, I always think that the system of punishment that we use is not truly the best, because many times people have behavioral issues which lead them to very bad behaviors that can better be corrected through treatment also than just simply punishing or putting away them for a long time. We know that kind of system doesn't really work when you look at the recidivism or return rate of people who come out and go back into criminal activity. It's pretty high. So I think there should be changes, and I'm very happy to see changes happening in the legal system in terms of the Sexual Offences Act, where you're able to now prosecute better, but also in terms of what we're doing for people with drug offenses, that there's the offer now of support or rehabilitation, just not putting people away and taking away the economic support from a home. So there must be alternatives to just the punishment. That's just on this side.
One of these days, as we may be fortunate to have a more in-depth discussion on your views regarding decriminalization or reduction in penalties for crimes such as marijuana possession and use, etc.
Yeah, I think we're also pretty backward. Sorry for the out term, but we got to catch up. Even in the U.S., they're moving to decriminalization, and they've been the one who will be most harsh. Canada's moved very fast, and many Caribbean countries have already done. We got to look at maximizing the benefits of some of these things that we see as dangerous, and look at also the good side to substances that are there.
Yeah. So the mental health issues or behavioral issues that you talked about, are there like any early warning signs that we can pick up, not as just professionals, but members of the household, members of community? What can we look for as like early warning signs in the vulnerable or susceptible persons who may then develop full-blown behavioral isures?
Yes, good question, Doc. And you know, as I said, many people can carry the emotions to them with themselves, and they alone know how they're suffering. They don't share it, they don't talk about it. But generally, you do see changes in behavior, and the things to look out for, if you're looking at children, the changes in behavior pattern where they're not going to eat that well, or the changes in sleep, There's withdrawn behavior. They're not connecting to their friends. They're isolating themselves in their room, spending too much time on their cell phone, which is a difficult thing. They always spend time on their cell phones. But those are the warning signs, especially loss of appetite, where they lose interest also in their usual hobbies or fun things and not part of the home environment. They withdraw into their rooms. You've got to find out what's going on, try to explore their thinking.
Are there things that we can do as people in the COVID era that can prevent or minimize our risks for developing mental health issues or behavioral issues?
Yes, and I think we've got to do it in a holistic manner, work to get the families more connected, that people must spend time with their children, don't just see them on the phones. Quiet, I believe while they're quiet there, don't let's bother them because they're not a nuisance. Find out what they're doing, take them off that phone. It shouldn't be their main focus. We find our children spending too much time. I've seen nearly about 3 cases, Doc, of children who have had seizure disorders related to excessive use of cell phones and playing video games on the phone for many hours. It's overstimulation of the brain, and as I said before, the brain is an electrical organ, it's a neurochemical organ. If you excite it too much, it's going to have flare-ups in its electrical activity. So thankfully those children have recovered, and commend the parents for bringing them to me, and we caught them early and they improved. Good, and they've learned their lessons. I mean, they're not going back to that. So to answer the question, yes, we got to be more involved with our children, get them outside, get them out there playing, get them involved in the schools, commend those teachers who are taking
What
time.
can adults do themselves though?
Adults have to get into an exercise program. They got to make sure the nutrition is good. They have to try to build the immune strength, do protection, wear our masks, and do the other things that we have to do, social distancing. But try to keep the connectivity, reach out to at least everybody should have at least one good friend that you can talk to, share feelings, connect to your spiritual group, all the resources that we can use, healthy resources. So make sure that we can have those resources, enjoy our Christmas as much as we can, even if we have to have distancing. Value the fact that we have these amazing mechanisms or technology that have come along to make communication possible. I'm going to talk to a group of counselors in Jamaica about using psychological first aid, being invited to do that talk, and it's by Zoom, all the way from Guyana to Jamaica. So
that's very good.
Quite amazing.
Mental health issues or behavioral issues have treatments that are available.
Yeah.
Are those treatments any different for those who would have developed mental health issue, behavioral issues due to the COVID-19 pandemic or unmasked in the COVID-19 pandemic? Are there differences in treatment for the COVID group versus those outside of the COVID group?
The persons who have developed neurological dysfunctions because of COVID, the virus entering the brain, may require special treatment. They would require advanced treatments in the special hospitals that we have. So that would be something that would be the high level, using medication to suppress bad immune reactions and improve the immune function and the health of the patient. So there are going to be special cases for people who are actively with the disease. However, persons who are affected emotionally because of fear of the disease or even haven't had it can improve with the current treatments we have, which are behavioral or through therapy or through medications. So there are a number of treatments we do. People who have had COVID and who have recovered often experience significant tiredness and depressions for fairly long time.
Right.
We're talking about months, sometimes several months before they're fully back to normal.
Yeah.
So they got to take special care, build up back the immune system, ensure that the nutrients. We're fortunate in Guyana to have fantastic foods and vegetables and fruits and so on. Use them, protect our elderly, who are also a very vulnerable group. Ensure that the elderly get a bit of exercise. We often allow them to just sit there for too long just allow them to sit down quietly thinking that they're thinking nice thoughts, and they may be very preoccupied or depressed. So we gotta look for all our groups of people. The young, healthy adults gotta care for the children and care for the older folks. So it's bringing out a lot of care that we must, as a society, do. And again, I feel the government is doing a tremendous amount, but we can't leave it all to government. We as a people must keep working together, support each other, encourage each other, and I want to commend many groups that are doing those very things, you know. People are coming out, showing the true Guyanese nature of care and love, distributing masks, helping people. I see people helping people on the streets. I see people bringing food for the homeless on the streets. It's amazing.
Well, thank you very much, Dr. Sharma. You've been sharing your expertise, your knowledge with us. And for our listeners and viewers, you've been watching and listening to Your Doctor and COVID. Remember, if you have any questions, feel free to send us a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. Thank you very much for watching or listening to the program today.